Hello everybody. I am here today personally to get some Botox shots because I come to Dr. D. This is Dr. D, by the way. Doctor's D.O.G. This is the D of the D.O.G. Dr. Danishmand. And I've come here personally to get Botox shots every 6 months or so. I come and receive my Botox shots because the muscles that are basically like when I frown, like right now you will see me in a couple of days. We're gonna shoot this and I'll show you. All these frown lines, all of this, as Dr. D calls it, 11 lines, and the Botox, it just relaxes those muscles. It's in a nice way, it paralyzes those little muscles. So when you frown on all of those lines in the forehead, they disappear. It's not just a disappearance of those lines. What's important is that if you frown, those frown lines go long enough, they get so deep that it will cut into the structure of your skin, that they at some point they become very permanent, and Botox does not do any good anymore. You basically have to do fillers and do more extreme things. So I'm excited. I come here like every 6 months and Dr. D does my Botox injections. Be careful where you get your Botox injections. There are lots of people out there that they go and take a weekend course and they just get the Botox done. There was a patient actually that was injected by a dentist, and they had gangrene, right, Dr. D? Remember that case?
Yeah.
Had gangrene, and the patient basically lost the entire nose, because when you're giving these injections, it's not just a bunch of muscles under those areas. There are blood vessels, there are all kinds of things under that skin. And so anyway, I'm excited to be here, and I'm excited to be a patient of Dr. D right here. And Dr. D can show his braces to us. He's a patient of ours.
I am.
So, Dr. D,
Yep.
I would like you to talk to
Sure.
our friends out there of all the benefits people can get from Botox injections.
Well, the Botox, is fantastic because I've been doing it almost for 30 years. It's a great product to use because it's easy to do for most patients. There's no downtime. You may get a little bleeding at the time when we do it, but it only lasts a few seconds usually. Bruising is rare, and if done correctly, Botox almost has extremely low side effects. And the results are excellent. Usually it lasts 4 to 6 months in patients, and it's used for a variety of things, ranging from wrinkles and muscle spasms all the way to anti-sweating and other uses that's being used as time goes on. But the main thing is that, as Dr. Gorbania says, you should do it early before you get these deeper wrinkles, because as the wrinkles are left there and the muscles are allowed to pull on the skin, the wrinkles basically cause permanent wrinkles and creases in the skin. And once that happens, Botox really is not powerful enough to take care of that. Then you need other modalities such as fillers or even surgery. But Botox, again, very simple to do if you know in the right hand. It's very like everything else. A good chef can make a great meal fast and quick with no problem without cutting his finger. So that's what we do. And of course, as Dr. G said, I'm the D of the D.O.G. and a patient of theirs now. I had my braces and it's fantastic. I had a great result. So far so good. It looks great, very low issues, and as my son said, I'm getting used to it. I don't even realize I have them now. So it's it's working great.
By the way, Dr. D is a great chef. So I'm gonna get in this chair and I'm excited to get my shots so I can get rid of those wrinkles again. And if you have those wrinkles, don't think that you have to live with those wrinkles. Get with somebody qualified like Dr. D and get rid of them. So here I am. Let's get going, Doc. All right.
Perfect.
I'm excited.
So the forehead is cleaned with alcohol. So we're going to treat the main areas that we're going to treat. We're going to treat the 11 marks, which are called the corrugator muscles that give you those 11 marks on your face, and then the crow's feet, and then of course the wrinkles up and down going across the forehead. So those are the main 3 areas that we're going to inject. So basically we get the corrugators first. So basically you inject the corrugator, so the needle goes in, Botox gets injected into that area. It's very simple. Usually it's not a problem. Sometimes as the needle goes in, you may get a little blood flashback, but usually it's nothing. So here's the needle, Botox goes in. So the frontalis is a little bit wider muscle, so we have to get it in multiple areas of the forehead. So that's why the needle is a different depth to make sure that we get the muscles. So these are the, and you can see the bubbles. The bubbles are just basically saline, and that goes down within 4 or 5 minutes, 10 minutes at most. It gets absorbed. That's it. Those are the areas that are treated. Now sometimes I ask, frown, go like this, raise your the other way. Yeah, perfect. Now come down, it's perfect. We got all the areas basically. Now, once you inject these areas on the forehead, you got to counteract the effects by injecting the crow's feet, which are these areas here. So these, you get the orbicularis muscle that goes around the eyelid, the eyebrow, like a horseshoe muscle. So we got to get all of these, and that improves all the wrinkles in these areas. You don't want to inject the eyelid itself, because then you get ectropion that pulls the eyelid down. So you want to stay away from the eyelid itself, because you don't want to inject that in these areas. And then you come back, and he has a wrinkle down here. That's from your procerus muscle, so that gets injected last, and that's it. It's basically injected. It's all injected. Really nothing, as you can see a little bit of where the needle goes in, you may get a little bit of course, but that usually stops within a few seconds. We can even let one of these bleed so you can see how much there is. Not much. You can just let it come out a little bit, and then just dab, and they usually go away, and it's nothing. And usually they resolve, and the crow's feet looks good. It's not bad. So it looks good. It's all done now. They usually know, you don't have to do anything. The only thing is you can't go bend your head down. We don't want you to go bend your head down the next 4 or 5 hours, because as you bend your head down, the Botox may travel into other areas of the body.
I feel so much more handsome right now already.
It's all because of me.
I feel like jumping up and down.
Yeah, it's all because of me.
Yes.
Just in my mere presence, you feel great. See?
Actually, that's true. You have such a positive attitude, Dr. D, that every time I see you, it doesn't matter how bad my day or how it is. When I see you, you brighten my day.
Same here.
You're a good man.
That's why when I don't. You're cool.
It's funny.
He's got energy. I don't have it. He's got energy.
No,
Man is full of energy, but
you give me good positive energy.
See, this is awesome. Now, you remember, once we inject this, the Botox toxin is going to take up to 2 weeks to work. It usually doesn't work the next day.
Last time, actually, I saw the
couple of days.
2 days later.
Yeah. Usually,
I saw the effect.
The earliest effect is usually 2 days, but it can take up to 2 weeks. So we tell the patients, sometimes they come back, oh, it didn't work. They wait 2 weeks and it completely works. And it should last 4 or 5 months. Easily last 4 or 5 months. And that's it. I mean, look at him. I mean,
ta-da!
Just like that.
I feel more handsome.
How much?
I already feel better.
How much easier can it get? I mean, nothing, no bruising.
This is great.
Piece of cake, very fast, and and we do it, just not for this. We do it for underarms for sweating. We do it in the neck for and other parts of the body. And I've been doing it since 1993, 92, 93 for everything. Under the arms, all the stuff that basically we use it for everywhere. Even though it's not approved by FDA, all that means is that they haven't done the studies for the FDA. But we do it, for
also for TMJ.
TMJ, the masseter muscle.
People who get headaches.
Migraine, of course. Yeah. We've been doing, and of course they get the masseter that their jaw really hurts.
Yeah.
In fact, I had a patient that had gone to the university, and they had done all kinds of jaw surgery and stuff on her, and she couldn't open her mouth. She could only open her mouth this much, and it was mainly because her masseters were so open. And I just injected the masseter. That's it. She could open her mouth. Beautiful.
Hello, I'm excited to be here today, 6 days after getting my Botox injections, and as you see, the wrinkles have pretty much disappeared. On the forehead, you see all the wrinkles are gone. On the side, those small wrinkles by the eyes, they have pretty much disappeared. Right here, same thing. I'm going to close my eye, open my eye, so you see it. The forehead, up, down, and then the frown lines, all the 11 lines as Dr. D was calling them, they are gone. So great result. I'm happy, and this is a really good use of Botox. Thanks for watching Doctors D.O.G. If you like to continue taking care of yourself, like, comment, and subscribe below.